Yes, we are going to pursue this for a long time.
I hope so.
Dr. Mixon?
Mr. Chairman, members of the committee, my name is Mary Megson. I'm a board-certified pediatrician, fellowship-trained in child development, a member of the American Academy of Pediatrics, and on clinical faculty at the Medical College of Virginia. I've practiced pediatrics for 22 years. In the last 15 years, I've worked only with children with developmental disabilities. That is, learning disabilities, attention deficit hyperactivity disorder, mental retardation, cerebral palsy, and autism. In 1978, as a resident at Boston Floating Hospital, I learned that the incidence of autism was 1 in 10,000 children. Recent surveys have suggested an incidence in several parts of the country of between 1 in 300 and 1 in 600 children. Over the last 9 months, I have charts now in an office I opened last June on 1,900 patients. Well over 1,200 of those have full-blown criteria for autism. I have 70 autistic children in a clinical trial, and I'm beginning a second clinical trial to look at treatment on these children. At the same time, the State Department of Education says there are only 1,522 children with the diagnosis of autism in the state of Virginia. Okay. Mental health, mental retardation agencies have scrambled to set up infant intervention programs and have had a hard time keeping up with the volumes of delayed infants and toddlers. I have served as an advisor for the city of Richmond and the surrounding counties as they set up these infant programs, also set up special educational programs for children with autism. Now, there are autistic classes in each county, several classes in several schools. It's very rapid rise over the last several years. The segment of children with regressive autism who develop normally and then regress, usually between 18 to 24 months, has increased dramatically. This past week, I was involved in 4 cases of children who were perfectly normal in their development until they had their school-age shots at age 5, DPT, hepatitis vaccine, MMR, and within weeks, they were autistic. In the past, this was unheard of. In the vast majority of cases, I have discovered that one parent or another reports night blindness or other rare disorders associated with a defect in something called a G protein. G proteins are proteins inside the cell that join receptors that sit in the cell membrane. They are cellular proteins that upgrade or downgrade signals in their sensory systems all over the body that regulate touch, taste, smell, hearing, and vision. They're important also in turning on or off multiple metabolic pathways, including those for glucose, protein, lipid metabolism. They also turn on and off pathways for cell growth, differentiation, and survival. Close to the age of autistic regression, we are adding a second defect to the G protein, namely pertussis toxin, which completely disrupts these G protein pathways. The opposite G protein pathways are on without the off switch. In my research, I've discovered that some children are protected if they have the lipid-soluble form of vitamin A that found from natural sources. In those children, especially the ones who are breastfed, they will be able to some of those children get the early vaccines in spite of having the genetic defect and do fine. However, the measles, mumps, rubella vaccine at 15 months of age depletes the body of all vitamin A. When they get the DPT the same day or several months later, many of these children disconnect. Several metabolic problems that I'm seeing repeatedly in these children, the pathway to break down the storage form of glucose in the body is on without opposition. These children have elevated blood sugars. In the past week, I've been made aware of 4 cases of autistic children who developed juvenile onset diabetes. There's a 68% incidence of diabetes in the parents or grandparents. Lipid breakdown is turned on without opposition. I have many 2.5-year-old children that I've diagnosed with autism who have serum cholesterols of 240 and above. There is an incidence in 1 of 3 of these families of a heart attack, a parent or grandparent under age 55. And those were diagnosed with hyperlipidemia. Of great concern, cell growth, differentiation, and survival is turned on which leads to uncontrolled cell growth. The first 60 families I examined, there were 62 cases of malignancies associated with the RAS oncogene in 60 families. I have also discovered that the measles antibody that the body makes once they're exposed to the measles vaccine cross-reacts with intermediate filaments. Intermediate filaments are the glue that hold the cells that line the gut wall together. So when they get that MMR vaccine, they develop a leaky gut. Intermediate filaments are also important in areas of high stress. And one of the areas of highest stress in the human body is the upper small intestine, right below the stomach. They develop a chronic autoimmune disorder at that point. The loss of the cell-to-cell connection also occurs in the blood-brain barrier and in the cells that surround the bile canicula where toxins are excreted from the body. So any toxins they're exposed to leak through the gut wall and they cannot pump them out of the body. The loss of cell-to-cell connection interrupts another process in the body that's very important called apoptosis, or the ability of neighboring cells to get rid of an abnormal cell. The MMR vaccine at 15 months precedes the DPT vaccine, which turns on uncontrolled cell growth, differentiation, and survival. Most families have reported cancers in parents or grandparents. The genetic defect found in 30 to 50% of adult cancers is a cancer gene, the RAS oncogene. This is the same defect that is the defect for congenital stationary night blindness. In Harrison's textbook of internal medicine, which is the standard textbook in medical schools all across this country, it is stated it is absolutely contraindicated to give the MMR vaccine or a measles vaccine in the face of vitamin A deficiency. I'm afraid that some of these children are facing that vaccine and they're already deficient in their vitamin A stores, and then they cannot reconnect pathways. Most of us in our current diets have the lipid-soluble form of vitamin A taken out. This lipid-soluble form is found in liver, kidney, milk fat, and cod liver oil. In low-fat milk products, however, it's taken out and another water-soluble form is added, which they are unable to absorb.
Pardon me, Dr.
Yes.
Mixon. You heard all those buzzers?
Mm-hmm.
That means that I have to run to the floor and vote, or else I'll be voted out of office.
Okay.
Which I don't want to happen. So would you please bear with me? I'll get over there and vote and get back just as quickly as I possibly can, because I'm very interested in everything that you folks are saying, and I do want to get answers to a number of questions.
Okay.
I think we have 2 votes. I'll be back just as quickly
Okay.
as possible. So we stand in recess. There are how many votes?
Always listen.
I think everybody better get a cup of coffee because there are 4 votes. It's going to take probably half an hour before I get back, so I apologize. We'll stand in recess.
Yeah, me too.
Thank you.
I'm glad that they left.
The committee will come to order. I want to really apologize to those of you who've been so patient today hearing all the debate. It must have been difficult for you, but it's also, I'm sure, been entertaining. Would you close those doors back there after everybody gets in? Okay, we left with Dr. Megson in a very impassioned moment of her talk. So,
Briefly, I was talking about in the vast majority of these children, I get a history from one parent or another of a disorder associated with a defect in these major signaling proteins, the G proteins. As I approached my research, I looked through the eyes of these children and tried to figure out what their world was like. And now that I have talked to them and know what questions to ask these children, I understand how these G protein defects affect their perception. They have a severe loss of rod function in their eyes. And there are 4 beautiful studies that have been out there, published for several years, that show this. They're left then with cone function in which to see their world. And cones give us color and shape in our environment. The only situation I could imagine that having only color and shape to organize my world was those magic eye puzzles. You know what I'm talking about? That you look beyond, you back up, and then you get a box of 3D. That's the only place in their visual field where they get the 3D impression of objects. Correct. Only then, when they look at a box like television or computer or a therapist who's sitting right in front of them, do they consistently hear the right words for what they're looking at. So most of the day, they're not hearing the right words for what they're looking at because they only have this one area of their visual field where they see 3D. I've treated some adults, and one adult I'm treating in Alabama calls me every week and gives me the measurement of his box as it grows and he gets better. It's really fun. And the other areas of perception and sensory perception are controlled by G protein pathways as well. And adding a second defect to these children who on a genetic basis probably have a first defect changes multiple sensations. Their avoidance of eye contact is an attempt to have light land off center in the retina where they have some rod function. So when they look at mom, when they look away from mom, they're actually looking at mom. And we make them force their pupils directly in front of us. We're making them look away from us. And on this form of vitamin A treatment, within days, they look right at you. The other things that happen in these children, suddenly mother's touch starts to feel like sandpaper on their skin because of modulation of touch. Common sounds sound like nails scraped on a blackboard. And these are words that autistic children have given me as they've gotten better. We think these children cannot abstract. We're sinking them into the middle of an abstract painting at 18 months of age, and they're left trying to figure out when the language they're hearing is connected to what they're looking at the same time. This defect for congenital stationary night blindness is on the short arm of the X chromosome, which explains the male to female ratio of autism, and it affects the cell membrane calcium channels that Dr. Goldberg just referred to in the hippocampus. These are the NMDA glutamate receptors in the hippocampus. These pathways are where major pathways processing language cross from the left side of the brain to the right. Pathways then go back through the hippocampus. The frontal lobe is where attention is added, executive function, inhibition of impulse, and all social judgment. When stimulated, these NMDA receptors, through their G proteins, stimulate other receptors in the nucleus of the cell, right there in the hippocampus. These receptors were discovered by Ron Evans in December 1998. In the animal model, when they are blocked, the mice are unable to learn or remember changes in their environment. They act like they have significant visual perceptual problems, and they have significant spatial learning deficits. Okay? Of great concern to me is that when the hepatitis B virus was initially isolated, the protein sequences were isolated, inserted into the gene for one of these vitamin A receptors, RAR beta. This is the critical receptor important for plasticity and retinoid signaling in the hippocampus in this area of major pathway intersection. This is what we'll have to look at the vaccine and see if there's any defect being produced by that related to the recent increase in autistic spectrum disorders. What I'm treating these children with is the natural lipid-soluble form of vitamin A. I'm giving their recommended daily allowance only of vitamin A in the form of cod liver oil to bypass these blocked G protein pathways and turn on these central retinoid receptors. In a few days, a lot of these children look at me, focus, they regain eye contact, and they talk about their box of vision growing. After 2 months on this vitamin A treatment, I give them a single dose of a medicine called bethenacol, which stimulates pathways in the parasympathetic system in the gut. What I discovered is that there are nerve receptors in the gut called acetylcholine receptors or muscarinic receptors that are blocked in these children. This medication mimics acetylcholine. It does not cross the blood-brain barrier. I give it to these children, and in the office sometimes, 30 to 40 minutes after the initial dose, after having pathways corrected for several months of vitamin A, when I bring them in, give them this medicine, observe them, they connect in the office. I've had children look at me, talk, act out, talk back to their mother, use vocabulary above their chronological age. This is a disconnect. And I've seen this again and again and again. Bill Walsh in Chicago has seen it, Woody McGinnis in Arizona. One child I've treated beginning last April, her IQ scores have gone up 105 points, from 60 to 165. This treatment improves cognition, but these children are still really physically ill. Their vitamin A stores are depleted, oftentimes before, if not before, at the time of the MMR vaccine, and they can't compensate it for these blocked pathways. Vitamin A has been called the anti-infective agent. It leaves them immunosuppressed when they're depleted. They lack cell-mediated immunity. Adding a second defect to this GI alpha protein blocks a very important pathway in the body where you convert retinol into something called 14-hydroxyretroretinol. 14-HRR is needed to turn on T cells. I give these children cod liver oil. Cold water fish oil is the only natural source of 14-HRR. The children get well. The parasympathetic nervous system, which is blocked in the gut, is part of what I call the peripheral nervous system. If we think of the nervous system as having two major parts, the central nervous system is the brain and spinal cord. The peripheral system is divided into two parts. The sympathetic nervous system is your fight or flight response, everything that happens to your body when you run away from danger. Dilate your pupils, increase your heart rate, increase your blood pressure. The parasympathetic side of the nervous system, peripheral nervous system, allows us to sit back, relax, focus, and digest our food. We are blocking the parasympathetic side of the nervous system, and these children are in fright or flight all the time. I've asked someone to bring these panels out so you can look at these children and look at their faces. I live in a small middle-class neighborhood with 23 houses. I recently counted 30 children who are on stimulants for attention deficit hyperactivity disorder. 1 week ago, my oldest son, who's gifted but dyslexic, had 12 neighborhood friends over for dinner. As I looked around the table, all of these children but one had dilated pupils. After 2.5 months of taking his recommended daily allowance of vitamin A and D and cod liver oil, my son announced, "I can read now." The letters don't jump around the page anymore. He can focus, and his handwriting has improved dramatically. In a survey in his private high school for dyslexic students who are bright enough to go to college, 68 out of 70 of those children report night blindness. They see headlights like starbursts, and they get a whiteout when their picture's taken. I think we're looking at a national disaster right in the face, and I think it's affected thousands of American children. The children, in a way, with autism, ADD, dyslexia are lucky because they're identified. There are many other children out there who are not identified, who've just been disconnected. We must direct all of our resources and efforts to establish multidisciplinary centers to treat these children. Insurance companies should pay for these evaluations, both medical and psychiatric, and treatment. For over a year now, I have been paying for speech therapy for these children. They are able to talk, but they don't know what to do with their mouth. I've had 10-year-olds wake up and talk, and insurance companies do not pay for rehabilitative services on these children. These children then are physically ill, immunosuppressed, have a chronic autoimmune disorder affecting multiple organ systems. We must get funding to look at the etiology of autism, identify these children prior to autistic regression, and prevent this disorder. Implementing vaccine policies that are safe for all children should be our first priority. Mothers from all over the country have brought pictures of their autistic children to Washington this weekend. Most of these children were born normal and lost to autistic regression. Look into their eyes, and you're going to hear their silence.
Thank you very much. We're going to read the text of your comments very thoroughly.
Thanks.
Dr. Upledger.
Yes, thank you. I'm John Upledger. I'm an osteopathic physician, and I thank you for inviting me to come and present.